thank you, Peter, and to the community practice for inviting me to speak to you today. My name's Nerys Edmonds and I work for the Wales Health Impact Assessment Support Unit in Public Health Wales. This is going to be a session in three parts. So this first part is about an introduction to health impact assessment, which is a data and evidence tool. The second part will be about how we've used health impact assessment to look at the effects of climate change on health and wellbeing in Wales. And then the third element will be about a collection of case studies that we've pulled together in a briefing paper that are around the different ways that health impact assessment can be applied to climate adaptation. So there's three chunks to this session. So the first one is a more general introduction to health impact assessment as a tool. This just to highlight, this is our team's website. If you want to find out more about health impact assessment, you can find lots of information in terms of our guide on how to do HIA, a number of reports and different resources to help health impact assessment in practice. So you can find us there. So firstly, just to start with, this is a kind of classic, the sort of agreed consensus definition of what health impact assessment is. And it's generally defined as a combination of procedures, methods and tools by which a particular policy or project, or it could be a scenario, may be judged as to its potential effects on the health of a population and the distribution of those effects. So it can be applied to a different scale. It could be a national policy, a local policy. It could be a project, a program, a major development. So it can be applied to lots of different scenarios. But it's also interested in not just describing the general health effects of an intervention, but also who is affected, and with a particular focus on equity and where a situation might affect health inequalities. So this is another definition that I've put up here, which was actually developed by Eva Elliott, who actually set up our unit in Cardiff University initially. And this sort of brings a bit of a broader focus on the process of HIA as a way in which different types of evidence and different values and meanings and interests are brought together in a process of dialogue to really anticipate the effects of change on the health of a given population. And I think this highlights that HIA uses a range of evidence. It doesn't privilege one type of evidence over another necessarily, but it recognises that there can be a range of perspectives on a particular scenario and how that might influence health and well-being, and that HIA can provide a valuable process to enable that to be carried out, really, that analysis. So HIA is a public health tool. It was developed within the sort of public health field as a way of trying to influence policy and practice to make sure that health and wellbeing are considered, particularly in areas outside of the NHS or health services. And it aims to basically prevent harm to health and wellbeing, maximise benefits, and to reduce health inequalities. That's its purpose. And it's very much was developed in recognition that, I mean, there's different figures you can put on this, but you could say around 90% of our health and well-being is influenced by factors outside of the healthcare setting. So things like housing, employment, the environment that we live in, having access to obviously basic things like drinking water, food, but also our social and community lives. Social capital is a big area that influences health, education. So it's a recognition that many areas affect health outcomes over and above health services, and health impact assessment was developed out of that understanding and really thinking about how can we influence all those factors that are outside of the health service. Within HIA, we use a very holistic definition of health and well-being that encompasses physical, mental and social well-being. And again, this is important because some other impact assessment processes like environmental impact assessment do address human health, but they tend to focus on physical health and more measurable or quantifiable aspects such as air quality or noise. And health impact assessment has a focus much broader than that looks at social and mental health as well. Excuse me. And it was also, HIA was also developed to support this approach really to policy making, where the ambition is that health and well-being is considered in all policies, um, like employment, housing, economy, not just within the health sector. So when we started our work looking at a climate change health impact assessment for Wales, this was a document that I looked closely at and found really interesting because it identified that health and well-being generally poorly integrated into adaptation planning. And they very much recommended that they saw HIA as a useful tool to influence both adaptation and mitigation policy for health and well-being. So that's provided quite an important context to our work. Um, so HIA is a flexible and scalable tool, which means that, as I was saying earlier, it can look at a small project. I've carried out HIAs on small community gardening projects, but it can also be used on something very large, like a major development, a road building project, a waste disposal site, and a national policy. So it can be quite flexible in that way. And it looks at both the potential benefits and positive impacts on health and well-being, but it will also look at any unintended consequences or negative impacts. And it aims to develop sort of a set of actions to maximise positive benefits for health and minimise or prevent any negative impacts. HIA can be used at different timings within a programme or policy. So it can be used prospectively in the design phase, and that's obviously where you've got maximum opportunity for impact, is at the, before something is I guess set in stone. So quite often HIAs might be done as a part of a consultation process, but it can be done as a review process and as evaluation as a retrospective tool. And they can be done at different levels of depth as well. So they can be what we would call a rapid HIA or a more comprehensive, which a comprehensive health impact assessment generally involves collecting some new evidence or primary evidence, whereas a rapid or a desktop will generally involve using pre-existing published evidence. So, as I've said already, the aim of HIA is to promote better health equity and maximise benefits for health and well-being, but it can also facilitate better partnership working between agencies and stakeholder engagement in terms of people understanding how their work influences health and well-being for a population. So it strengthens partnership working. It's also, people often value it because it's a systematic and structured approach to thinking about health and well-being, and sometimes having that shared understanding and a solid framework I think can be really helpful, because thinking about health and well-being, because it's so broad and everything influences it, can sometimes feel quite overwhelming. So actually having a clear structure can be really useful for that. It's also, we very much advocate a participatory approach to health impact assessment, where there's engagement of a diverse range of stakeholders, including community groups. Health impact assessment, as I've mentioned, aims to address both health inequalities and health inequity. So health inequalities are the different variations in health outcomes that we see in the population. So one example of that may be that women tend to live longer than men. You could say that's a health inequality. But health inequities are the ones that are what we would say kind of societally driven. They are unjust in the sense of where you look at where you live dictates your health outcome. So we have, I mean, certainly where I live in Swansea, I think if you live in one part of Swansea, the average life expectancy is around a decade lower than if you live in another part of Swansea. Yet these people live maybe 3 or 4 miles apart. That would be a health inequity. And that we see that pattern in different parts of the UK, where there's a kind of a postcode difference, and a lot of that is linked to socioeconomic factors but also the quality of the neighbourhood environment that people are living in as well. In health impact assessment, we also recognise that there's a range of different inequalities and that they do intersect and overlap. So we consider both socioeconomic inequalities, but also things around geography, protected characteristics as well, and other vulnerable groups. There's this set of values and principles that underpin HIA practice, which really do inform the way that we go about health impact assessment. And just to highlight a couple, I've already talked about equity, but health impact assessment should be an open and transparent process. And I think that's really important in terms of particularly when you may be doing a HIA on a fairly controversial or sensitive subject, that people can have trust and faith in the findings and the process and how decisions were made about the impact assessment. So it's very important that a HIA is carried out in a transparent way where the decisions informing the HIA are open and recorded. It's obviously important that they're based on robust evidence and that any limitations to the evidence are highlighted, and that they're ethical and as free from bias or kind of undue influence as possible. So you can find out more about the ethics of impact assessment. There's a link there at the end of that slide. So I'm going to just briefly describe the HIA process. I'm not going into detail in the methods today, but it's a 5-step process, which is fairly common across impact assessments. It starts with what we call screening, which is an initial assessment where you basically do a kind of rapid assessment, maybe with a small group of people who've got different expertise to contribute. And it's really deciding, does this proposal or situation affect health and well-being, and how, and is there any value in doing a HIA, a full HIA? If you decide, yes, there's value and we've got an opportunity to influence a decision or a policy, then you could proceed to the second stage, which is scoping. And this considers things like the geographical boundaries of the impact assessment, what type of data you're going to collect, who are you going to involve and how. So it's kind of that sort of planning stage of the impact assessment process. Then you move into the appraisal stage where you gather the evidence and analyse it. And then you move into reporting and recommendations. And then you should also do a review and evaluation, ideally, as well. So again, it's a fairly structured process, which again, I think can be helpful. Thinking about the type of data and evidence that we use in health impact assessment, there's 3 key types of data. So the first thing is what we call a population profile. And this looks at who are the people that are going to be affected by the policy or the scenario. What do we know about them? What do we know about their health status and the factors that are affecting their health status? So it may be something like, what's the housing quality in that neighbourhood? What's the age range? What's the level of multiple deprivation? What's the income level? Have we got indicators around levels of long-term illness, mental health conditions? Anything about transport, really looking at what are the relevant indicators, what do we need to know about the population who are going to be affected so that we can actually understand what the impact of a new change might be on them. Then we look at stakeholder knowledge and evidence. So that's more of a qualitative aspect. And we might do this through focus groups, interviews or workshops, or sometimes a survey. And most commonly in our unit, we tend to do participatory workshops where we bring together a whole range of stakeholders and we facilitate a discussion and that dialogue about what people's different perspectives on the potential impacts would be. And then the third area is more about what we already know about the potential impacts of, let's say, a new housing development or a new school or a change of some type, in change in air quality, what's the likely impact that might have on the population. So it's really looking at both peer-reviewed and grey literature. So then within the kind of appraisal process, we bring that together to really ask, structured around those wider determinants of health. So how might this proposal, so for example, in this situation, we're talking about climate change, how might the effects of climate change impact on social and community factors such as community relations, community cohesion, So we will go through a kind of systematic process looking through those determinants of health. How might it impact on education? How might it impact on employment and economic opportunities? How might it impact on people's health behaviours like physical activity? So we go through a systematic process and bringing together those different sources of evidence. So that is a bit of a whistle-stop tour for HIA, but hopefully it will give people some understanding of the process. I'm going to move on now. I'm going to switch slides and I'm going to come on to the talk about our HIA on climate change. Okay, so this next bit is going to be focused on the health impact assessment that we carried out to look at the effects of climate change in Wales. You've got the full reference there, and including there's been a whole range of people who've contributed to the work. So just to acknowledge them, and there's a link there that you can access all the outputs. So to start with a bit of background to this work, we actually initiated this work in 2019. Our organisation approached our unit to carry out the health impact assessment after the Welsh Government declared a climate emergency. And we established a strategic advisory group to bring in that stakeholder engagement and to help us plan and scope the health impact assessment. And yeah, that was a really important part of the process because, you know, climate change is very complex, it's very broad, and we needed to be clear about what the aims and objectives of this particular health impact assessment were going to be. Our work on it was very much delayed by our work during the COVID pandemic, so we've published it this July in 2023. So, oh, sorry, I skipped ahead there. One of the things that was really important, as I was saying, in our work with the advisory group and our sort of scoping before getting going with the HIA was to really think clearly about what our aims were, because obviously there is a lot of different sources out there. There's the climate change risk assessments. There's things like the Lancet Countdown that have a set of indicators around the health impacts of climate change. So we really wanted to be clear about what the added value of this health impact assessment was going to be. And in the end, we identified these as our objectives. So the first one was very much trying to bring that more holistic perspective about the physical, mental and social aspects of health and well-being, and what climate change means for that broader conceptualization of health and well-being, which I think, you know, it's only, I think, in the quite recently that the Lancet Countdown has begun to look at mental health. So I think there's been a kind of limited focus on that to date. We also really wanted to focus on population groups and people's lives and we came up with this where they live, work, learn and play, because when we were looking at different risk assessments, it felt like there was quite a risk assessment. The climate change risk assessment tends to be focused very much around policy sectors like agriculture, international transport, and health and well-being were sort of contained in the buildings and communities element. But actually people's health is affected by all those things. It's affected by food and agriculture, it's affected by transport, it's affected by infrastructure, and that actually people's lives interact in lots of different ways with, you know, their homes, their communities, where they work, their workplaces, their schools. So we really wanted to bring that broader perspective. And I think the other aspect was trying to focus on the inequalities and how different population groups might be affected. So we wanted to really bring that lens to the assessment. We wanted to provide evidence to inform adaptation planning, recognising from the work that we'd looked at that actually health wasn't very strongly represented in adaptation planning. And it was really aimed to inform both our own organisation and other decision makers' policies and programmes around climate change in Wales. So the scope for the HIA was Wales as a country. We've got about 3 million people in Wales. So in a way, I guess from a numbers perspective, you know, that's similar to some cities, isn't it? But our geographical spread is much bigger and we've got lots of diverse geographies in Wales. We looked at both negative and positive impacts. And I'm going to talk a little bit more about the evidence we used in a minute, so I'll skip that bit. And we followed a sort of the standard HIA process. The other sort of framework we drew on for this work was this conceptual framework around socio-spatial vulnerability and climate disadvantage that was developed as part of the Climate Just work with the Joseph Rowntree Foundation. And I personally found this really helpful in when I was looking for evidence to understand different vulnerability, to really understand this link. Obviously, we've got the hazard, the type of climate change hazard that, which might be flooding, it might be heat, it might be wildfires. We've got the exposure. So, how exposed are people to that hazard? And that was really helpful for us in Wales, because if we think about the hazard of flooding and coastal erosion, well, actually, in terms of exposure, 60% of our population live near the coast. So actually, we have got a lot of our population is exposed to that hazard. But I think that sort of helps you understand that relationship. And then when you look at that box around vulnerability, there's a number of aspects that feed into vulnerability. So some of it is sensitivity. So sensitivity is, for example, if you've got a respiratory condition, then you're more sensitive to things like wildfire smoke. You'll be more sensitive to changes in air quality. If you're a young child, you're more sensitive to changes in air quality. You're more sensitive to overheating. So it's kind of, there's physical sensitivity, but then there's also things around this adaptive capacity that contribute to vulnerability. And this is about, have you got the resources to prepare, respond, and recover from some kind of climate change event? So have you got the money to adapt your house or to repair your house? Have you got the social networks that are going to be there to support you if your house gets flooded and you have to leave it? How are you going to recover? So I think for me, this framework's been incredibly helpful in really digging down a little bit to work out why people are vulnerable and what that means. So the evidence base we used in this health impact assessment, so we commissioned a literature review from some colleagues at Bangor University, and that was really helpful. It looked at both international literature and UK, because we felt that there was actually a lot of really important learning internationally and experience about the health effects of climate change. We carried out two workshops with a whole range of stakeholders. We interviewed 19 key stakeholders, and they were people with particular expertise in some kind of climate impact. And then we had a population profile which looked at different indicators of health in the population. So, one example of that is, we looked at things like housing quality in Wales. We've already got quite a lot of homes in Wales that are very damp. So that's a relevant piece of information for us. So I'm going to focus this section on how we've communicated the findings, because obviously this webinar was focused around communicating the data. So I've tried to bring that focus to this presentation rather than talk in detail about what we found. And the first bit I was going to talk about with this is that because of the delay in being able to publish our full report in 2021, we decided that we wanted to get some key messages out in time for the COP26. So we decided to produce some infographics with some of our key findings, and we worked with stakeholders, some of our original advisory group members, we actually had a little workshop online, and we thought about what are the key messages that we really want to get across about the health and well-being effects of climate change. And we drew on some of the literature around that, things like what are the public's concerns around climate change, and what are some of the limitations in people's understanding about health impacts. So we started with we basically put out 4 infographics in 2021 before we published our report. And the first one was this one, which was about trying to get some key messages out there about why planetary health and nature is important for human health. And as you can see, we've kind of focused on physical well-being, mental well-being, social well-being, but also what is sometimes called ecosystem services, such as clean air, water, and food. But I chose in this to call it Essentials for Life, because not everybody knows what ecosystem services are. So this one was really about the key message that, nature supports our health and well-being. And that's why, we need to look after the planet, but also we need to understand that interdependence of what's happening to the environment is going to influence our health and well-being. The second infographic focuses on 4 different population groups that we've looked at in the health impact assessment. So we've got children and young people, older adults, people on a low income, and people with long-term health conditions and disabilities. And the aim of this really was to highlight the cumulative impacts that will impact on different population groups. And it goes back to what I was saying earlier, really, about, people living their lives are potentially going to experience a whole range of impacts from climate change. It may be extreme weather and flooding disrupts the education of children. It may be that they get overheated from playing sport. It obviously also can mean that they're anxious about the future. But for older adults, there's the sort of disruption to health and social care, as well as their vulnerability to things like flooding and overheating. So it's, I mean, these infographics have been really, really helpful to us. We've had quite a number of people replicate them for their own agenda, their own sort of programs. But they've really have helped us get some key messages out. We chose to focus one on food security and one on particularly on the health and wellbeing impacts of extreme heat in different settings. So they're available to download if people want to look. But what I would say is, in terms of communicating the data, this kind of visual approach really, really helped us. The other thing that we have done in a number of our reports, including the Climate Change HIA, is to use some clear descriptors to categorize impact and characterize impact. And this can be quite useful for policymakers in terms of helping them see, well, where are the major impacts and how certain are the major impacts and how long are they going to last? So people can begin to kind of get a feel around, but also what's the strength of evidence for different impacts. So we look at, is this a confirmed impact? Are we already seeing it, or is there strong direct evidence? Is it probable? It's more likely to happen than not, but it's not completely certain. Or is it just possible? It might happen, it might not happen. We don't have the evidence to say yet. So it can be quite a useful way of presenting the data around health impacts from that point of view, because they are really complex. So within the health impact assessment, we've got these tables that list all the different impacts on the determinants of health down the left, and then you've got the kind of categorization. But it can help people see quite quickly what your findings are of different impacts, and what's the strength of impact on different aspects of health. So this one on here is about food security, and you can see that in terms of these positive impacts around potentially a more sustainable diet being more beneficial to health and people adopting that diet. We know it's possible, and we know that there is a bit of a shift in that direction, but we can't really say for sure that definitely will happen. We haven't really got that clear indicator yet. We've also produced downloadable chapters on each of the determinants of health to make it easy for people to access the information that's most relevant to them. So this is the one on flooding, and each chapter's kind of got this summary table in it at the beginning to basically summarize what the potential positive impacts or opportunities are and what the negative impacts are. This is another example of the summary table that we've produced. So for mental health and well-being, so you can see there we've got 3 stars means a major negative impact on mental well-being, and a confirmed negative impact on mental disorder, particularly related to flooding. So that's just some different ways that we've presented the data in our health impact assessment. And we've also developed a set of key messages to try and, again, there's a huge amount of information in our report, so sometimes it's really important to try and distill that down to some really key messages if you're trying to get that across. So going back to that first one is really important, is, our health and well-being is dependent on the health of the planet and its ecosystems. Tackling climate change has really important benefits for health. Climate change is going to have a major impact on health and well-being and equity, and we're already seeing those impacts. Some groups are more vulnerable than others and more exposed. We urgently need more action. That action needs to go beyond responses to individual episodes of extreme weather, that we need those long-term preventative solutions. And also that adaptation policy in other sectors will impact health outcomes. We've also focused on some cross-cutting issues. I'm going to talk a bit more in detail about that in a minute, but linking to public participation and sort of support for communities. So I'm going to summarise now the different chapters that we've got in the health impact assessment. So this slide gives you the overview of all the different chapters. So these are all the determinants of health that we've looked at within the health impact assessment. So we've got a whole chapter on food security and nutrition. We've got 2 sections that are more about behaviours, health behaviours, looking at physical activity and alcohol and substance misuse. In terms of social and community factors, we've looked at community resilience and cohesion, population displacement. We've got a whole chapter on mental health and well-being, and then there's a whole number of chapters on living and environmental conditions. And they cover everything from water to supply, air quality, housing. Then we've got economic conditions, access to services, and some macro factors like transport and infrastructure as well. And then in terms of population groups, again, quite a number of population groups that we looked at. And these are groups where we've tried to where we've highlighted particular vulnerability to climate change, because obviously the whole population is going to be impacted by climate change, but it's in terms of planning for adaptation, we need to be thinking about how different groups may be impacted so we can make sure that we're meeting different people's needs. Just to highlight a couple of examples of why this approach is helpful for adaptation planning is that, so for example, for Wales, we've got rural areas on there. Now we've got huge kind of amount of the land in Wales is a rural area. We've got agriculture, we've got farming communities. We've also got a lot of rural areas around the coast as well. So we've kind of got a combination of rural and coastal. So obviously for us, any impacts on things like the agricultural sector, on land management, we know evidence from Australia. There's some interesting evidence about the impact of drought on the mental health of farmers. So I guess what I'm trying to highlight is that for Wales, those impacts on rural communities are really relevant and important for us to understand. But for some people may be planning in a more urban area, so they'll be more focused on urban communities. Obviously, as I've said already, we've got a lot of coastal, we've got a long coastline in Wales. About 60% of our population live on the coast. So impacts such as coastal flooding and erosion are really relevant to our adaptation planning and those impacts on coastal communities. So it's really important that we had a chapter on coastal communities. We've also, you can see highlighted there, former and current industrial areas. So again, the sort of industrial heritage of Wales, where we've had a lot of coal mining, creates particular risks as well. We've got disused coal tips that with heavy rain are posing concern. We've already seen an example of a landslip in 2020 that was actually, and there's a whole program of work now going on there. But so there are, I guess what I'm trying to highlight is health impact assessment offers an opportunity to really think about what are the particular risks and vulnerabilities for a particular geographical area. And for some cities, it may be about, well, we've got a lot of high rise flats and actually they're very vulnerable to overheating. For other areas, it may be, well, we've got a big river coming through our city and we're really concerned about flooding. And so I think it's having that perspective. Occupational groups are really important as well in terms of your workforce. So again, with farming and forestry being an important area in Wales, we've got quite a lot of outdoor workers, but there's also occupational groups that are vulnerable in health and social care and things like transport and manufacturing. So again, if you're looking at your local area, it'd be good. It's really helpful to look at the NOMIS data on occupational breakdown for different local authorities. You know, what type of occupational groups have you got in your geography, and how exposed might they be? So there's lots more to say on that, but that's just a couple of examples about why looking at a population perspective is important. Just have a quick sip of tea. We also pulled out some from particularly our engagement with stakeholders, but also the literature. We identified some sort of cross-cutting themes in our work that we felt kind of influence health and well-being. So they're not the direct impacts of climate change, like, you know, a direct impact of a flood, but actually the process of responding to climate change also has health impacts. So it's been quite interesting looking at how communities and decision making is happening in terms of things like flood risk management and engagement with communities about planning for the future. And actually that can have impacts on health, because obviously, you know, people can be very anxious about what might be going to happen to their community, to their home. So we really felt that needs to be considered about a positive practice in terms of engaging communities, but also how we communicate risk to communities when sometimes, you know, the data can be really complex. I mean, I've been on a really steep learning curve looking at all these different climate projections on water and flooding, and you know, there's a lot of very, very technical information in climate change. And actually, how do we then communicate those types of risks to communities in a way that is clear and understandable, but also that you know, we are clear about any doubt that's linked to that data, or what the planning assumptions are. So we've highlighted a number of other aspects that influence health and well-being over and above the direct impact of climate change itself. And then really important part of the HIA process is identifying your recommendations or areas for action, because that's actually what, you know, you want a HIA report to make a difference, not just to present a whole load of data and evidence. So we highlighted 8 areas for action. I'm not going to talk all the way through them today because you can have a look at them in the report. But I think I've got the list of them here somewhere. This first slide, and I'm going to probably come back to this in the next segment in a bit more detail, but was really about saying we need people to apply the findings of the HIA in all aspects of adaptation planning. So I'm going to come back to that bit. And then these are the other areas for action. Now, these titles are quite broad. There's a bit more detail in the report underneath them, but I just wanted to highlight a couple of things. So, you know, we've obviously said there needs to be a lot more investment in adaptation in terms of including workforce capacity and the skills. You know, we need to improve our practice around risk communication and public engagement. We need to invest in co-benefits for health. So there's a whole load of actions there, and we've identified some areas for further research as well. We've done quite a lot of work around the mobilisation of the findings and engagement, and I think that's been another example of the benefit of HIA as a process, is that it starts and it continues as a process of engagement with a wide range of stakeholders. So we've been able to use the findings of the HIA to engage and respond to various policy consultations on things like flooding in Wales. We've also been able to take some windows of opportunity in our own organisation around influencing our long-term strategy, but also we've got a new adaptation plan being developed in Wales, so we've been able to feed the findings of the HIA into that as well. And we've been sharing learning in numbers of different ways, including with this community, but also internationally. So we've got some colleagues in New Zealand who have developed a sort of scoping report to help inform HIA on climate change. And we're also talking to other colleagues in various places about the work. So we've really tried to share the learning that we've had with doing the HIA. So this last section is going to talk about a briefing paper that we've published with a colleague, Mark Drain, looking at some global case studies about how health impact assessment's been used in adaptation. That's a bit of a link to the document. So the aim of this document really was to identify and evaluate some existing practice about how HIA has been used in adaptation practice. And I think what's quite interesting looking at the different examples is that it kind of shows that flexibility of health impact assessment. So some people have used it on a sort of sectoral level. Some people have done it on a more of a place-based approach. So, for example, you could say our climate change impact assessment for Wales is a kind of place-based one. So it's looking at a defined population. Some other people have done it more around a particular ecosystem. So one of the examples is around the water system. So, it can be sort of framed in different ways. And then looking at the adaptation planning cycle, and this is a basic adaptation planning cycle that's from the statutory guidance in Wales on adaptation. So it's a fairly standard planning cycle, really. But I think what we wanted to highlight was that, HIA can be used both in terms of investigating, so exploring and describing health impacts. It can be used while you're planning. So it could be used to say, well, we've got this proposal of a particular approach to adaptation. We want to evaluate what the potential health impacts of that may be. And then implementing and reviewing, you could use health impact assessment to say, well, we've put in place this adaptation, let's say some sustainable urban drainage or a flood defence, and we want to evaluate what its impact on health has been. So I guess health impact assessment can be used across that cycle, depending on what your objective is and what you want to find out. And we've also just highlighted in this sort of Venn diagram is the kind of links between sustainable management of natural resources, so that kind of long-term thinking, preventive thinking, participatory approach, and the HIA values of kind of being, again, prevention, sustainability, participation. And in Wales, we've also got these 5 ways of working that are linked to the Wellbeing of Future Generations Act. So we very much see these approaches as complementary. So I think one of the helpful things that can be useful to think about health impact assessment is that it's really good when it complements what you're already, or some of what your existing work is trying to focus on. So if you're trying to engage a community, it could really help with that. If you're trying to take a preventative approach, then it can support that as well. So these are the 5 case studies that we've looked at. You can see that 3 of them are in Wales, and then 2 are in the USA. So was in Minnesota. So that was a regional level HIA. And then there's this really interesting program of health impact assessments that was carried out in Alaska with the Alaska Native Tribal Health Consortium. And looking at different Indigenous communities and how they are going to be affected. And that's a programme that started in 2010. I'm not going to talk through each of these case studies today because they're all explained in the document. I'm just going to touch on a couple of them. One of them, a really useful piece of work that a colleague of mine did, was looking at water scarcity in Wales. So that was a national level HIA as well. But that was a really interesting piece of work that was done initially in response to 2018, where we had some initial water scarcity, but we didn't have an official drought. Now, obviously, then was it last year or the year before? Now I've lost track. I think it was last year, 2021. We had an official drought in Wales. But this HIA really highlighted some key issues that planning needed to be advanced on because the risk of drought is becoming greater. and most people don't associate drought with Wales, but we can have, I think what's been highlighted is since 2018 is, we can have water scarcity issues. So this presentation, I'm just going to touch very briefly on these case studies, but they're all there in the document to read more about. So the one in South Central Minnesota, it was looking at, it was a health impact assessment looking at the adaptation plan for the regional priorities. Now, what ended up happening with this one is that they didn't in the end have enough resources to look at the whole adaptation plan. So they chose to just look at soil and water conservation. And they developed a set of pathways through which changes to soil and water would impact on health. But I guess one of the sort of highlights that we've highlighted from this one is that, in this sense, the health impact assessment was only partially realised, really. They didn't manage to do it on the whole adaptation plan. So it's quite good lessons in terms of sort of scoping, how are you going to scope your HIA? Have you got the resources? How are you going to carry it through? This slide summarises the case study around the tribal health, and some of the drivers for that were about this kind of lack of localised data about how different communities were going to be affected, but also this need for community involvement. So this case study is a really good example of how critical community knowledge can play into a health impact assessment, and also the process that they went through in terms of the governance. They didn't proceed with the health impact assessment until they had that community agreement that they wanted to engage in that process. So it's quite interesting in terms of that community empowerment of taking ownership of, how is our community going to be affected by climate change and what do we need to do about it. But this is I can't remember, it says here 10 communities. So there's a set of 10 health impact assessments as part of this work that were all done on quite small communities living in quite different circumstances. And then we've got this example from Natural Resources Wales, which is much more what you might call a programme management approach in terms of how Natural Resources Wales have been working to embed health impact assessment into their programme management. So Natural Resources Wales are the environment agency for Wales. They do, they manage a whole range of natural resources. And so what they've been doing is kind of integrating health impact assessment into their planning processes. And we've got an example here around a flood project and how they did that, and what some of the learning for them has been about that. So you can see their community participation should be conducted in the design and implementation phases, thinking about how this investment in infrastructure can benefit health and well-being. So some of the key learning, it does take time and resource to do a HIA. That needs to be considered. How you sort of scope your HIA in terms of looking at those holistic health impacts and different pathways, putting it in place as soon as possible if you're planning adaptation activity, and combining kind of more quantitative data with that community level insight as well. Oh, yeah, and I just put a link there to, we've got an event coming up next week that's around local climate risk assessments in Wales. So I think I was going to highlight that to people. We've got a set of public services boards in Wales that are regional partnerships that are going to be carrying out local climate risk assessments over the next 5 years. And the health impact assessment will be a key input into those risk assessments. So there's a number of different ways, once you've got some data and evidence in a HIA, that it can be used to inform different policies and programmes.